Welcome to this educational video about polycystic ovarian syndrome, which is also known as PCOS or PCOS. Especially since September is PCOS Awareness Month. Now actually, PCOS is quite common amongst women and can vary in its incidence between 5 to 35%. It has three main characteristics, the first one being either irregular or absent menstrual cycles due to hormonal imbalance. The second is due to a raised level of androgens, which are male-type hormones and testosterone. This can cause either acne or hirsutism or thinning of head hair. The third feature is the ultrasound feature, which is quite characteristic for polycystic ovarian syndrome. As you can see on the slide up here, these very small tiny follicles or cysts represent immature eggs and unruptured follicles. This is because these eggs do not reach their full potential and we don't have a dominant follicle as seen on the other side of this slide. Now, these symptoms and the problems associated with PCOS usually start to appear around the age of puberty, and it appears with irregularity of cycles. Now, this is not a devastating diagnosis and it's certainly not a stigma, because the management of PCOS is directed towards the symptoms that the patient presents with. So if a woman is coming to me with irregular cycles, then we offer treatment and management for irregular cycles. If she's requesting management of acne or hirsutism, then we will direct our treatment courses towards that way. But also, it may be associated with delay in conception and inability to conceive. In that case, it's usually due to anovulation. Now, the most commonest cause of infertility is anovulation, meaning the inability of the body to produce an egg, and the most commonest cause of anovulation is polycystic ovarian syndrome. The management can vary from simple things, giving tablets or medications in the form of ovulation induction, IUI, or even IVF. The other thing that we need to be aware of is the other symptoms that can be presenting with polycystic ovarian syndrome or may not even present, and they're hidden symptoms. And the other thing that I would like to raise issues with is insulin resistance and weight gain. There's a high degree of insulin resistance in some women who have polycystic ovarian syndrome, and this can lead to major issues and challenges with weight loss and weight gain throughout their lifetime. I feel it's important that women need to be aware of this because it will be a lifelong challenge throughout their lifetime, and it's due to the insulin resistance, which can be managed by various different ways, but to be honest, the most easiest and commonest way to do this is weight loss and improving lifestyle. If women are able to lose 5 to 10% of their body weight, their cycles become regular, they start to ovulate, and all of these problems seem to disappear away. But more importantly, what we need to be aware of is delaying or even nullifying problems that may happen in pregnancy, such as diabetes and high blood pressure in pregnancy. And even later on in life, women may be exposed to diabetes and metabolic syndrome and heart disease. So it's really quite important to be aware of these features and control your weight. But women who have no periods at all need to be aware that to protect themselves from cancer of the lining of the wall of the womb, known as endometrial cancer, they need to have 3 to 4 periods a year. Now, what I usually advise women is seek advice from your gynecologist if you're having gynecological issues, and seek advice from your fertility expert if there's any issues with fertility and delay in conception. I really do hope that I've been able to provide an informative video to you in simple terms to empower you with the knowledge on how to manage polycystic ovarian syndrome, and also to inform you it is not a stigma or a devastating disease, and it's quite common amongst women. And there's also a very interesting thing that I'd like to inform you about, that the characteristic features on ultrasound scan and the way the follicles show are known in ultrasound findings as a necklace of pearls. So always remember that whenever you feel down, that you are a necklace of pearls.